Have you ever felt like the world is slowly losing its color? Like someone's put a hazy filter over everything you see? Well, you're not alone. Today, we're diving deep into one of the most incredible procedures out there, cataract surgery. We're going to cover the whole journey, from those first blurry moments to the amazing tech that brings the world back into sharp, beautiful focus. So, let's get right into it. It's a question a lot of us start to ask. Maybe you notice that a blue sky just isn't as vibrant as you remember. Or maybe driving at night has turned into a real challenge with all the glare from headlights. That slow, frustrating fade. That's the classic sign of a cataract. And the culprit? It's hiding right there, in plain sight, inside the natural lens of your eye. And honestly, that's the best way to think about it. The lens in your eye is supposed to be perfectly clear, right? So it can focus light. But with a cataract, it starts to get cloudy. That cloudiness scatters the light instead of focusing it, and suddenly everything looks blurry, like you're permanently looking through a foggy window. Okay, so your doctor tells you that you have a cataract. Does that mean you're being rushed into surgery tomorrow? Not at all. Actually, in the early stages, it's all about managing the symptoms and just making the most of the vision you've still got. And some of these early steps are pretty clever, It's not a one-size-fits-all thing. Just getting a new updated pair of glasses can make a huge difference for a while. And your doctor might give you some advice that sounds a little weird, like using brighter light if the cataract is on the edge of your lens, or actually dimmer light if it's right in the center. Dark sunglasses are going to be your new best friend to fight that glare. And for some people, special eye drops can widen the pupil just enough to let light sneak around the cloudy spot. So here's the key thing to understand. All those non-surgical tricks, they're great for managing the situation, for buying you some time, but that's what they are, temporary fixes. They don't actually stop the cataract from getting worse. The only way to truly get rid of the problem and bring back that lasting clarity is the surgical solution. And that leads us to the big question, right? How do you and your doctor figure out when it's the right time to go for it? It's not just about what a chart says, it's about how you're living your life. For most people, the decision really boils down to one simple thing: quality of life. I mean, when that foggy view is stopping you from reading a book or driving safely at night, or even seeing the expression on a loved one's face, it's time. But sometimes there are more urgent medical reasons. A really advanced cataract can actually cause the pressure in your eye to spike, which can lead to glaucoma. Or it can get so cloudy that it's like a wall, blocking your doctor from seeing and treating other problems in the back of your eye. When that happens, surgery isn't just a choice. It becomes a necessity. All right, so the decision is made. Now we get to the prep work. And this isn't just a quick checkup. This is a super precise process of measuring, mapping, and planning everything about your eye to make sure the result is as perfect as it can be. So here's how it breaks down. First, your doctor takes a really good look at the overall health of your eye. Then, they'll measure your vision with incredible precision. After that, they check out your retina to get a little preview of just how clear your vision could be once that cataract is gone. And then comes the really cool part, biometry. Think of it like they're creating a custom blueprint of your eye, measuring its length, the curve of your cornea, all down to the tiniest fraction of a millimeter. All that data goes into creating a brand new lens, an intraocular lens, or IOL, that is custom-made, just for you. And now, let's talk about the surgery itself. Honestly, modern cataract surgery is an absolute marvel. It's so precise, so minimally invasive, and so quick, it's completely changed the game for patients. The name of the technique is phacoemulsification. Yeah, I know, it's a mouthful, but the idea behind it is just brilliant. Instead of a big cut to take out the old lens, the surgeon uses a tiny probe with high-frequency ultrasound to gently break the lens into tiny pieces, which then get vacuumed out. It's really less like traditional surgery and more like microscopic sculpting. Let's walk through it. So, step 1, it all starts with a teeny tiny incision on the cornea. We're talking 2 to 3 millimeters. It's so small, it usually seals itself up. No stitches needed. Then, the surgeon makes a perfect little circle in the front of the capsule. That's the thin bag that holds the lens. Next up, a little bit of fluid is gently swished in to separate the cloudy lens from that capsule. This just helps it move freely and gets it ready to be taken out. And here's the main event. That tiny ultrasonic probe starts vibrating incredibly fast, and it just breaks up or emulsifies that old cloudy lens. At the same time, a little vacuum gently whisks all those tiny pieces away. Once the old lens is gone, it's time for the grand finale. The new high-tech lens, which is made of a soft, flexible material, gets folded up, kind of like a ship in a bottle, and slid right through that same tiny incision. Once it's in, it just gracefully unfolds and settles into place, ready to bring your world back into focus. Now this is probably the most exciting part of the whole process for you as the patient. Because you're not just getting a clear lens, you get to pick a new lens that can totally change how you see the world, often making it even better than before. So let's look at the main options. On the left, you've got the unifocal lens. Think of this one as a specialist. It's designed to give you perfectly clear vision at one specific distance, usually far away. On the right, that's the multifocal lens. This one is more of a jack of all trades. It has these different zones built right in that let you focus on things up close and far away. It's kind of like having built-in bifocals. So, how in the world do you choose? Well, it really boils down to your lifestyle. That unifocal lens is amazing for distance, but you'll almost certainly need reading glasses for up close. If you're dreaming of a life with fewer glasses, you look at the premium lenses. A multifocal lens can give you that freedom, but the trade-off is sometimes seeing halos around lights at night. Then there's the EDOF, or extended depth of focus lens. It gives you a really smooth range of vision from far away to intermediate, like your computer screen, though you might still need glasses for really fine print. And if you have astigmatism, that's when your eye is shaped more like a football than a basketball, a special toric lens can correct that at the same time, giving you incredibly sharp vision. Okay, surgery's done, the new lens is in, and now we're on to the final stage, recovery. And the great news is, for the vast majority of people, it's a really smooth and easy process that leads to this whole new world of clear sight. Your doctor will give you a simple game plan to follow. You'll use some eye drops to prevent infection and help with inflammation. You'll need to take it easy for a little while, so no heavy lifting or anything like that. And after a couple of follow-up visits to check that everything's healing up perfectly, you might get a new, fine-tuned prescription for glasses. And just look at these results. They're overwhelmingly positive. Modern cataract surgery has an absolutely incredible success rate. Almost everyone gets a dramatic, life-changing improvement in their vision. And for that tiny, tiny percentage that has a complication, they are almost always minor and easily managed. Now, it's always smart to know about potential issues, but it's also good to know they are very treatable. Right after surgery, a little bit of swelling on the cornea is pretty common, and it usually just goes away on its own. Later on, something called cystoid macular edema can pop up, but it's typically handled with anti-inflammatory eye drops. But the most common issue is something else entirely. Okay, listen up, because this is super important. Months or even years after your surgery, you might notice things getting a little bit hazy again. Don't worry, your cataract is not growing back. What's happening is that the natural little bag that's holding your new lens has just gotten a little cloudy itself. It's a really common thing, and the fix is unbelievably simple. A quick, totally painless laser procedure right in your doctor's office that clears it up for good. And so, we end right back where we started, with a world that's finally back in focus. You see, cataract surgery is so much more than just a medical procedure. It's a chance to see everything with fresh eyes. It's seeing the lines on a loved one's smiling face. It's reading a book without struggling. It's the freedom to drive confidently at night. It's your world, just restored in high definition. So the only real question left is, what are you going to look at first?